Hi, welcome back to another webinar. This is Janani, one of the AOD champions attached to the Primary Health Network. So today we are going to talk about the myths and stereotypes in AOD use. So substance use or stereotypes. What comes to our mind when we picture someone with a substance use disorder, perhaps somebody with a mental health concern or living on the streets? Again, depending on the type of substance use, you might imagine different types of people. For example, alcohol stereotypes, marijuana stereotypes, cocaine stereotypes, and so on. I wonder if I have watched the movies Train Spotting. It's about heroin addiction, and also Wolf of Wall Street. It's about street drug use. So actually, the reality is there is no one type of person who is more likely to experience substance use disorder than another. It's important to understand anyone can use substances and encounter the dilemma of addiction. So let's move on and see what actually addiction is. So addiction, it is a disease that changes the way the brain works. Is addiction a brain disease? Actually, it's a controversial topic. So in a person with addiction, they commonly experience withdrawal symptoms. We all know that they've got cravings, negative emotions, and impulsive behavior. So as doctors, we want to treat them, guide them through this, and support them in all possible ways to overcome their problems. So let it be alcohol, let it be cocaine, let it be marijuana, let it be heroin. So what do? We help with a supervised detoxification plan. We counsel them and provide them the therapy. Let it be cognitive behavioral therapy or interpersonal therapy. Formulate an individualized plan, then offer them a support group participation. So this addiction, or the people subject to addiction, the wide range of patients, from one end with mild symptoms, just the withdrawal symptoms, and to the other end, like a high functioning addiction. So when you talk about high functioning addiction, so these individuals will still be able to function normally, to hold on to their activities, their job, and take care of their daily responsibilities. So when you say it is a brain disease, actually, as I mentioned before, it's a controversial topic. So according to Dr. Neil Levi, one of the leading experts in the Florey Institute of Neuroscience and Mental Health, Royal Parade, the University of Melbourne. So he claims that it is not necessarily a brain disease. He's argued that the effects of alcohol produces quite a lot of changes in the brain that is not limited to one area. And as we all know, that there is a area so we all know that's a pleasure and reward system in the brain. So these substances, let it be alcohol or anything, so it can cause repetitive changes or manipulate the brain in this pleasure and reward system. And that is the cause for this repetitive behavior. So in other words, so these changes, the long-term depression of the reward circuitry and the increased activity in the anti-reward circuitry. And in addition to this, there can be changes like alterations in the midbrain dopamine system, leading to increased levels of dopamine. And also there could be some changes in the frontal regions of the brain, resulting in inhibition of the impulses. So what happens if all these pathological changes lead to a functional impairment? Then definitely it becomes a brain disease. So then at that circumstances, addiction becomes a brain disease. And so Dr. Nee also says that he's talking about a mismatch theory that supports it's not a brain disease. And according to him, so this functional impairment does not take place most of the time. So it is not a brain disease most of the time. So what causes this addiction? There are several causes, like genetic causes. And according to Dr. Kenneth Leonard, director of the Research Institute on Addictions, genetic causes accounts for 50% of the risk of addiction. And then certain brains are more vulnerable to addiction. And the National Institute on Alcohol Abuse and Alcoholism, or the effects of alcohol, says that comorbid conditions like mental health problems are a leading cause for addiction. And then again, repetitive usage or prolonged use also can cause a high risk situation for addiction. When we talk like addiction, we very often encounter these words: alcoholism, alcohol addiction, alcohol use disorder. So for a lot of doctors, it's all mean the same. In a way, it's correct. So when you have impaired judgment, a loss of self-control and cravings becomes a problem, and it's termed alcoholism. And it's equivalent to these terms: alcohol use disorder and alcohol addiction. So let's take a look at the common myths about drugs and people who commonly hold these assumptions who are using them. So stereotypes of being safe. In recent times, cannabis has acquired a place where you are more comfortable to talk with your doctor. So it's considered as quite a safe thing to use by a lot of individuals. A health halo that is discussing about the potential benefits of the drug while overlooking the risk of using it in an inappropriate situation or like a patient. So I would like to introduce one of my patients. Obviously, she's been using cannabis for a while, and this is her own lived experience. Just listen.